Denise, welcome. Do we have Patrick Moran?
Patrick will not be attending today.
All good, no worries. Just wanted to make sure. So I'll
Yep.
recognize that we have Denise on before you go, and you can introduce your members and we'll go from there. And we only have Department of Budget Management here for questions. I assume they'll make some remarks. They just haven't really sent us anything, so we'll just have them here, okay?
I'm sorry, Chair Young, it looks like we don't have anyone yet from DBM, just so you know.
Okay, got it. Well, let's wait till we do then. Should we wait till we do? We should probably wait.
No, I think we should go ahead. So
Good. All right then. Whenever
you're
you're
ready and you're live. OIS got us up quick.
Great. Welcome, everybody. This is the Oversight Committee on Personnel. I'm Delegate Pat Young, Chair. It is December 16th, 2 p.m. Appreciate everyone for joining us. This has been a while in the making. There's been discussions since the pandemic began, since we've been having issues nationwide and statewide related to COVID-19 about the health and safety of our workforce. We tend to get together every year anyway to discuss, one, how our state employees are doing and how the environment that they're working in, how we can be better at understanding what they're dealing with and how the department and the administration deals with its employees. It's imperative this year that we discuss their health and safety, the environment that they're working in, what accommodations have been made, and what they're experiencing now that we have been 9 months into a pandemic. And now that we know that there is a vaccine, and we're discussing how that vaccine is going to be distributed to the population and to first responders and critical frontline workers. Generally, we, as state employees, we have a commitment to everyone that does a service for us and for the citizens of Maryland. We're always looking at how do we serve them, how do they serve us, and how we can do a better job of it. We will be hearing from the Department of Legislative Services today, members and representatives from AFSCME and from the Department of Budget Management to talk about what's been going on the last year, what they look at in the future, and how we can continue to help. With that, I will introduce Jason Kramer, a Senior Policy Analyst from the Department of Legislative Services, to give us a presentation from them and some background related to the last year and our numbers in general related to our state employees. Thank you, Jason, for joining us.
Thank you, Chairman Young.
I like your setup, sir.
Oh, thank you. It's my living room. I'm Jason Kramer. I'm from the Department of Legislative Services. I'm the personnel analyst. And I believe June's going to put up a presentation for you all that I'm going to work through. And we can go right to the next slide. The first topic, I was asked to discuss several topics. That includes the number of cases among state employees, the notification procedures that state agencies are using when informing employees of potential COVID cases or exposures, and state agency teleworking policies, as well as PPE, personal protective equipment, supplies and needs for state employees. We can go to the next slide. As DLS was compiling this data, it became apparent first that there's no statewide standards for that agencies are using to track and monitor, I shouldn't say monitor, to track the numbers of cases among employees. And it was also clear that there are two broad categories or types of agencies. There are the public-facing agencies that are unable to telework, that have to work in person. Most of those agencies have publicly available dashboards that are regularly updated and on the internet. And then there are the non-public facing agencies that are either mostly or entirely teleworking. And these agencies don't really have any standard for tracking. Some agencies do track cases, others do not. Many only track leave usage among employees. Some of the feedback that we got from agencies with that about why they don't track or what their policies are, it has to do with privacy issues around reporting COVID cases. There's also self-reporting issues where it's somebody may have COVID but not be reporting it, especially if they're teleworking. And it's impossible or difficult to pinpoint where transmission of COVID has happened, whether it was on the job or not on the job. And again, I would say there's not really a consistent approach to tracking cases among state employees. We can go to the next slide. So like I said, there are the public-facing agencies. The sort of the three major ones would be public safety, health, and juvenile services that obviously don't have a lot of ability to telework. This is data that was pulled last week from the state's public COVID dashboard. As you can see, there's nearly 2,200 inmate cases and 13 deaths in state facilities, as well as nearly 1,400 cases and 2 staff deaths in public safety facilities. In the health department, there have been nearly 400 patient cases and 4 deaths and more than 500 staff cases. And unfortunately, since this was finalized, we've learned of 1 staff death at Spring Grove Hospital of a staff member there. Juvenile services, there have been 27 cases and among youth residents and 180 cases among staff at juvenile services facilities. We can go to the next slide. Higher education is another area that provides public information on dashboards. These dashboards, for the most part, are individual at each campus. One thing to note about higher education is that approximately half of the campuses provide information just on faculty and staff, and you can see that for College Park and Towson and UMB. And other campuses just aggregate both faculty and staff and student cases into one number, and those numbers are in the bottom graph. We can move on to the next slide. The one exception to what I was talking about earlier about public-facing agencies having publicly available dashboards is MDOT. MDOT does not have any sort of publicly available information about cases among its employees, although it does have some significant numbers of publicly facing workers like at MVA or MTA. As you can see there, information provided by MDOT at the end of last month, there's been nearly 300 cases among employees at MDOT and 1 death, and 45 cases at the Maryland Transportation Authority and 1 death there as well. When you go on to the other agencies that are for the most part mostly teleworking or entirely teleworking, there weren't a lot of cases reported by the agencies. The ones you see here at the bottom are some of the higher counts among state employees. And just as an example of the difficulty with looking at these numbers, state police with 65 cases, the agency reports to us that they only believe about 20 of those were contracted while working. So these numbers don't always tell the whole picture for state employees. Next slide. As well as, we can go to the next slide, June. The next topic I was asked to talk about was notification procedures for state employees when there is a positive case. For the most part, this is on a case-by-case basis. If an employee tests positive or they are suspected positive or have an exposure, the employee deals on a case-by-case basis with human resources at that agency to determine whether they were in close proximity with other employees based on guidelines put together by MDH, sort of set by the CDC. And those employees that are determined to have had close contact with that person are informed rather than sending out information to every single person at an agency or an office. The Department of Health has worked with human resources directors across the state to provide an FAQ for HR directors when dealing with this issue. Next slide. The next topic I'll go over is executive orders and teleworking policy for state employees. The current executive order has state employees working at elevated level 2. And what that means, that's a very long set of guidelines, but in general, flexible operations, Sick employees should stay at home and not come into work, and an easing of telework requirements. And on the next slide, I can explain what easing telework requirements means. So not only was this in the executive order, but the governor sent a letter to agencies reminding HR directors that there should be teleworking whenever possible, and that policy has been eased. The prior policy did not allow teleworking while children were at home. The current policy does allow for that. It also required employees to work during core work hours, so 9 to 5 or 8 to 4, whatever those hours may be. Current policy allows more flexibility of when hours can be worked, and previous policy required rigid reporting on what work was being accomplished, and that requirement has also been done away with. We can move on to the next slide. The final topic I'll discuss is PPE, personal protective equipment. Overall, the feedback from agencies to DLS is that they have adequate supplies of PPE for state employees, and needs and requirements for each agency is different. So I'm just going to go through a couple of examples of a couple of agencies. So here's some of the information about state police. They were going through 560 N95 masks a week and 34 boxes of gloves per week at the peak of usage. And they were sending out boxes in waves to keep up, and now currently have enough on hand so that's resupplies can be made on request. DGS has spent nearly $360,000 to date on PPE. We can go to the next slide. At MVA, when offices reopened in June, employees were provided with 2 cloth face coverings, hand sanitizer, and disposable gloves. MVA reports that they have a 2-month supply on hand of PPE, including hand sanitizer, wipes, gloves, face shields, gowns, seat covers, other items needed at MVA. Next slide. Public safety. Public safety has probably the most rigorous set of requirements for how PPE is used in different areas of each facility. And you can see the statistics on the right-hand side, nearly 2 million pairs of gloves, 150,000 N95 masks, and they report currently having enough supplies on hand, as you can see in the right-hand column there. I would also add that the Maryland Correctional Enterprises has provided a lot of PPE supplies for public safety. The next slide. Health facilities, obviously another big requirement for PPE. This information is PPE distributed by MDH, and it includes items distributed not just to state facilities, but also to local health departments, nursing homes, and other healthcare providers. There is about more than $650 million worth of PPE has been distributed by MDH. Next slide. That's all I have for you. I included some sources of where all this data can be found, both for the state and for higher education. If anybody has any questions, I'd be happy to do my best to answer them.
Thank you, Jason. Looks like we have a few questions. I see Delegate Geraldine Valentino-Smith.
Thank you, Mr. Chairman. Thank you, Jason, for the report. Just trying to understand a couple things with respect to the state. So did the state develop, in conjunction with a health officer advising the state, a new or revised policy for state employees that have to come to work? So that's kind of one question, like who is kind of making the COVID policy for state employees? And then, and this may be something for you or for DBM. And then in the private sector, constituents have been talking to me, and only some in the state, that if they're required to present on a campus, they're being asked to take, make some affirmations that they won't travel to certain states. And if they travel, they'll report that to their employer, or that they won't attend big organized functions and sporting events or tournaments and things like that. And if they do, they'll report that to their employer. And even at one of the state agencies, I was given information that even they traveled to New York and they came back and took a COVID test and were negative, they still had to stay out the 14 days. So then the next question is, if somebody has to stay out and they can't work from home and they've used up their leave, what's happening? Are people being forced to use their leave because they've had a contact or a situation for quarantine? So those are a couple of questions that maybe you or DBM.
So for the second question, either DBM or higher education institutions could answer those. I'm not sure what the policies are there. On the first question about setting guidelines for when employees have to come to work, I think DBM may be able to provide more detail, but it's more that the expectation is if at all possible, teleworking is preferred. And that guidelines have been eased as much as possible to allow for that. And when that's not the case, then it becomes in-person work and different expectations come into play.
Okay, thank you. So to your knowledge or DLS, we don't have yet a sense, DBM will come up, how the state formulated guidelines and if they're consistent from department to department.
No, I think that the overriding goal is that people should telework if at all possible. And once it's not possible, then it becomes an
I'm really talking about for the ones in the chart that you said have to be on campus. And we'll talk to DBM. I see Secretary Brinkley nodding his head, so he's probably. Thank you, Mr. Chair. I'll reserve the questions then for Secretary Brinkley.
Thank you, Delegate. And beat me to the punch. Welcome, Secretary Brinkley, as well as Cynthia Kohler from Office of Personnel Services. Next question goes to Delegate Solomon.
Thank you, Mr. Chair. It was actually very along the lines of Delegate Valentino Smith's question. Jason, I was just curious, do you have any hard numbers on the percentage or the rough numbers of state employees that are teleworking versus, or any data on who could be teleworking? And maybe that's a better question for Secretary Brinkley, but I didn't know if you all had sort of a personnel report.
I don't have that at this time, and DBM may have that. I do know from the information that we've gathered that other than sort of those agencies that you would expect, like health and public safety, the vast majority of other employees at state agencies are teleworking.
Okay, thank you.
Delegate Bridges.
Yep, thank you, Mr. Chair. Jason, I just had a question on the slide 5 that you put up. You had the cases at 286 for MDOT, but you had MDTA outside of MDOT. So were you saying all the modes with MDOT, MVA, Port, all those other modes are the 286 cases, but MDTA had the 45? That's
correct, yes.
Okay, yep. Do you have it broken down by those other modes?
I don't, but I'm sure MDOT could provide that if we asked, yes.
Yeah, okay, thank you.
Further questions for DLS from the members? Okay, I think we're good. Jason, appreciate the presentation and the information. Thank you.
Thank you, everyone.
Next, we'll have members from ASME, and I know that we were joined by President of ASME, Patrick Moran. Nope, he is not here. My mistake. We're joined. I'll let Lance introduce all of his folks instead of me trying to guess at who we had on the list. So, Lance, welcome. Always a pleasure to see you. Take it away.
Likewise, Mr. Chairman. Thank you. Lance Kilpatrick, Legislative and Political Director, not the President, of AFSCME Council 3. I want to thank the House Appropriations Oversight Committee on Personnel for holding this briefing this afternoon. You're going to hear from 4 of our members from different state agencies and higher education who are located across the state. Despite their testimonies being from different agencies and such, there's going to be one common theme, and that is inadequacy. inadequacy of access to PPE and planning, inadequacy of testing, of contact tracing, inadequacy of staffing, and inadequacy of pay for their service and sacrifice that they're making to keep Maryland moving forward during this pandemic. Thank you, and I turn it over to my members now. Mr. Chairman, you have
When they're,
two pre-recorded and 2 live here.
I understand. Okay.
Yeah.
Let's,
Dana, can you go? Thank you.
okay. Share audio.
All able to hear that?
No, if you could share audio from
Give me
settings.
1 second, I apologize.
An officer at the Maryland. My name is Judith Ehela, an officer at the Maryland Correctional Institution for Women. Today, I want to respond to how the state has responded to the COVID and the provision, the PPE that we have been provided with. PPE never seem to be guaranteed as we continue to fight for our safety and the safety of the inmates and member of our families. This situation is not getting any better as we know that the second wave is on the rise. COVID testing is being done monthly, and it should be done more frequently than once a month. And the inmate population is not being tested regularly. What they're doing is random testing. And while this is going on, the emergency paid sick leave, we are running out of emergency sick paid leave. And some are being made to use their personal time when they get sick. All of this is without the hazard pay. Hazard pay has just been cut off just right the time when the second wave hit. This is unfair. Clearly, we are still having problems. Things are not what they seem, and we thank you for your time. Please help us. Thank you.
Hi, I'm Brianna Suter from ASME Local 354. I'm a resident associate at the SET program at the Potomac Center in Hagerstown. Potomac Center is a long-term care facility where we care for developmentally disabled adults to help them safely re-enter communities. The last 9 months during the pandemic have been really challenging at the Potomac Center and other state facilities. We currently have 22 confirmed cases of COVID-19 among our staff and residents. 2 of my coworkers are currently in the hospital for COVID-19 complications. 2 state hospital workers at other facilities died of COVID-19 just last week. We're tired of the administration saying one thing publicly, but not doing all they can to protect their own employees. Throughout the pandemic, it's been a fight to get adequate PPE. Staff are still reusing face masks, and gowns have been in short supply. And now, even though we're working with positive individuals, we don't get true N95 masks. We've also seen huge spikes in the positivity rate all across Western Maryland. And there's still inadequate testing. Even though I work in a long-term care facility, we're only getting tested once a month, and it can take up to 5 days to get the results. Testing of the residents is even more infrequent. I'm also part of the statewide labor management committee, who meets with the MDH administration every 2 months. We've been calling for a statewide response plan for the state hospitals since the beginning. We even gave them a plan modeled on what has worked in other states, and they ignored it. Now, 9 months into this, we're having outbreaks happening in the majority of our state MDH facilities. We still have MDH facilities doing its own thing on PPE and quarantine procedures. At my facility, we still don't have an adequate plan to truly isolate residents. Times are getting really tough. We were critically short-staffed even before the pandemic. And now with so many staff out because of quarantine, it's placing an even more extreme burden on those reporting to work every day and are being forced to be mandated just about every day to cover the extra shifts. I just want a safer facility for our residents and my coworkers. And I want to make sure my facility doesn't cause outbreaks of the virus into our surrounding community. We need adequate PPE. We need more frequent testing and faster results. We need plans and resources. Please help. Thank you.
Okay, we also have Kim Henson from the Motor Vehicles Administration. Or at least she's on my list. Do we have? Sorry, June or Dana, do we?
Ms. Henson's here. She just has to unmute.
Gotcha. Oh, there she is. Ms. Henson, if you unmute yourself.
Yes, my apology. Good afternoon, everyone. My name is Kim Henson, and I work for the Motor Vehicle Administration in Glen Burnie, Maryland. Back in October, I contracted COVID from work. I learned about this from an employee who put a post on her Facebook page. Management was not making us aware of anyone who had COVID. Employees were learning about this from each other. The NBA, what they did was they chose to install wooden partitions to separate us. However, they do not protect us upon standing. If you sneezed or coughed, it would reach your coworker. Also, we were on alternating shifts. So when we first returned back in June, we had an A day and a B day. So you worked 3, you were off 2, and then the opposite, work 2, we're off 3. And I think that was really helping us. I don't know if I said as a result of me getting COVID, my husband also contracted COVID and he was really, really ill. I mean, he was really ill. And so I would like to see us return to the alternating days because right now we're not able to telework in the office that I work in. The other thing is that, I just feel like the alternating shifts would be in the best interest of everyone to really cut down on this virus spreading. Additionally, there was a wall that separated our office from the office next door to it. That office was removed by a manager who no longer works for the MVA. And I feel like going back to the alternating shifts and putting the wall back would allow at least the virus to be contained to the various rooms as it did before. So I think that would at least help to eliminate that open space that is between us. And I just thank you for your time and your attention.
Thank you for your comments and your experience. Next, from the University of Maryland College Park, we have Selena Sarjusan. If you don't
Pretty close.
Welcome.
Yeah.
Oh, close.
Hi there.
I was
Yeah,
close.
pretty close.
So
Yeah,
sorry.
it's not an easy name, but my name is Selena Sarjusan,
Mm.
and I'm a clinic coordinator on the University of Maryland College Park campus. I'm also shop steward for my department and also executive board member of AFSCME 1072. I'm here today representing my brothers and sisters at Maryland's public colleges and universities. We have unfortunately dealt with very dangerous environments inconsistently because there is no master plan. So the supervisors, deans, and administrators are all doing different things, both at different campuses, but also on the same campus in some cases. And I have very personal experiences with that on my campus, even as of today. So it's been consistent from the beginning. There's like never been a time where we haven't been dealing with some sort of inconsistency that is basically putting my union members, students, and community members in danger. So there's really no one leading the charge. The left hand does not know what the right hand is doing. At many campuses, the administration has either refused to bargain with us about health and safety, like at College Park, or refused to bargain substantively for months until things got really bad, like at Frostburg. So in my position at the University of Maryland Health Center, I can tell you that back in the beginning of the pandemic, we were on administrative leave. We are thankful for that. But when we were asked to come back after weeks and months of communicating with university leadership, there really was no plan to bring us back safely. And we had been, in these meetings, and we had given like very specific direction and concerns, and really none of that was adhered to. And the goal was just get back on campus, get back in the building. In some cases, social distancing was being ignored. Mask mandates weren't even happening. And at this point, what we're seeing, we're having issues still with communicating the contact tracing. Even as of today, what is happening is on a managerial level. There are managers who are telling workers, well, you weren't around them for that long, so you can come into work. That is not a manager's job. That is a medical professional's decision. And so I'm having to instruct my union brothers and sisters to contact the health center and speak with a provider that can give them true guidance. And so, and it is the manager's job because we have a daily symptom tracker. So when you answer those questions honestly, and it tells you don't come to campus, what's happening is that the managers are telling the workers to come to campus anyway, when really they're supposed to follow up with their own doctor, or they can even call the HEAL line. At College Park has a HEAL line where they can call and talk to a medical professional. And so what we see is we have managers that are circumventing, the guidelines that have been put in place. And I work in direct patient care. I am responsible for testing the student population, faculty, staff, and students. I'm administering flu shots, so I'm directly in my full PPE doing this kind of work. I can tell you I have not received not $1 of hazard pay. I am considered an essential employee in my appointment information, but what I am is an expendable employee because they just throw us into the fire. There's no preparation, and they are building the plane while it's in flight. And I think that although some campuses are doing the best they can, what would be helpful is to have one governing body, like to have this leadership, to have one leadership making these mandates and making these guidelines so that what's happening at Bowie is consistent with what is happening at the University of Maryland College Park. The way the buses are being cleaned at UMBC, that should be consistent with the way the buses are being cleaned on the College Park campus. And that's not what we're seeing. And so our workers' level of safety, there's a huge disparity, and it just depends on where you work, and it depends on who's in charge and who's taking it seriously. And our safety should not be hanging in the balance of people's personal opinions. And also, just one last thing, each campus is working with a different health department, so their local health department. We've also noticed that the follow-up seems to be a lot better depending on how good the relationship is with that campus and their local health department. In some cases, the local health department is completely overwhelmed and can't really lend aid to the campus. So who does that affect? It affects the students, the faculty, and the staff. And so I heard a previous person state that they don't want to be the reason why there's an outbreak or a super spreader event or putting the community members at risk. But when things are not being organized or led from the top, then the things, things are going to, safety will be affected. Thank you for your time and listening to our concerns today.
Thank you for your comments. And I'm going to open up for questions. I just have one myself, and it can apply to Ms. Henson, Ms. Sarah Juicing, and Lance too, if you want to comment. We're going to hear from the department, and they're here to answer questions about what's been going on the last 9 months and their response to the pandemic. And I know that on paper, this is why we bring you all here, so we can get your personal experience on the ground about what you're experiencing, what the implementation looks like. Do you get the feeling that the response, at least at your level, has been more of a, this is not permanent, this is going to pass, and we're just going to deal with it in the short term and not figure this out in the long term? Does that seem to be your experience, and what you've seen from the folks that you have to report to, or that are supposed to be implementing some of these practices and keeping you all safe?
If I may answer, I would actually say that what you just described is actually better than what we have received. In the middle of this pandemic, and I would say this would be as recent as June, July, August, when people were first being asked to come back on campus, the attitude was business as usual, as if nothing was happening, as if we were not in the middle of a global pandemic. We were in meetings with university leadership over at College Park every single week since March, and yet they didn't even tell us that the students were coming back over Memorial Day weekend to gather their things. And so we had workers in what had been vacant buildings, like cleaning and doing their jobs, and they look up and there are students there with their parents, and there's groups of them. There's nobody mandating mask wearing, nobody mandating who was entering the building. And so that is just one example of how callous, really, and careless some of the response has been. And it hasn't been because no one asked them or told them that these were concerns, because we've been in constant communication. The universities have refused to bargain over health and safety. And what they've said in response is, well, we've had a conversation, like we've talked to you guys about it, but they have not bargained with us.
Gotcha. Ms. Henson, is that? You're on mute, ma'am.
Just to piggyback off of that, I would agree with Selena, although we're under two different entities. I'm under MDOT, MVA, but it has been business as usual. When we returned in June, I did feel like they were taking some measures by the alternating days to at least try to keep us safe. And then after they put up these wooden partitions that are probably just a little over a foot high, it was business as usual. It was getting everybody back in the office, back to doing, work every day without any consideration. And the unfortunate part that I feel for many of us is that when conversations were had with management, it was pretty much because they were forced to have them, because of the word of mouth that was going around among employees sharing, did you hear so-and-so had COVID and this person has COVID? And then so it became a dialogue among ourselves, but not necessarily coming from management. And when we heard from them, it was because there was enough of us who were hearing things. So then they felt like they had to come to us and have this type of conversation. And so when I returned back to work, I did ask one of the managers about, restoring the wall that was between us, and was told that it would be restored. But today it has not been restored. And so just this past week, there were 2 town halls that were held by our administrator. And one of the questions an employee asked in the town hall, which to me was a defensive stance on the part of our administrator, was the administrator asked, well, how do you know you got it from the MVA? Well, I can assure you that among all my family members that were tested, I was the only one who was positive, and my husband unfortunately got it from me. The last thing I'm going to say is about the, I guess the essentials, if you will, that were handed out, that the wipes that we were told are supposed to be like, I guess 70% effective or have 70% alcohol, only have 30% alcohol. So that to me is saying that when I'm trying to sanitize or feel at least a little bit safe with the things that I'm utilizing to clean my area are not as effective as they should be. So in my opinion, the NBA is doing the minimal that they can do just to say that they are doing something. And that's all I'll say for now.
Mm-hmm. Ms. Kilpatrick.
Yeah, I just want to build on something that both Selena and Kim have said and kind of clarify it a little bit, because I'm sure the Secretary and Ms. Kolner will have a difference of opinion. It's been my experience that time and again, the issues are with the frontline supervisors and managers, right? We know there have been some agencies that have actually promulgated things that sound good on paper. The execution of those procedures and protocols, when they exist, and I will not say that they always exist, but when they do, there seems to be real issue with having those frontline managers and supervisors actually executing and implementing those things. So I just want to be clear on that. That to me is where some of the largest concerns rest.
Thank you. Opening up for questions from any of the members. I don't see any. Oh, sorry, Delegate Valentino Smith. Sorry, I was looking for the hands in the participation
I was
box.
trying to get to the hand in the
You're
butt.
good.
Just a eye-hand coordination thing going on with Zoom. Thank you to the people that took the time to testify. I guess really my questions then are for Secretary Brinkley, if he's available to help bring some understanding.
So yeah, he's going to come up next, and I just want him to give an opportunity.
Oh, is he going to actually testify and then we'll ask him questions?
No, well, I mean, not going to put him on the spot. We welcomed him for questions, but I assume he always comes prepared if he'd have something.
I would rather give him the opportunity to go ahead and give prepared remarks before I ask questions. Thank you, Mr. Chair.
Got it. Are there any questions directly for ASME or Lance? Seeing none, thank you so much for your presentation and for sharing your experiences with us today. We're going to move on. And Secretary Brinkley, welcome. I know that you've come prepared to answer questions. I just wanted to make sure I gave you an opportunity to, you always come prepared. So I wanted to make sure that you had a chance to kind of talk about what you've been doing if you wanted to, and just give the committee an update since we've been suffering through the pandemic, from your perspective, what's being done at the top and what you feel is being done all the way down to the frontline worker. So after you, sir.
Happy to do so. Thank you, Mr. Chairman. I got to tell you, it looks very impressive. You look like you're in a radio studio there. You've got the headphones and the microphone and everything else. So that's
Thank
very
you.
cool.
I'm preparing for the session.
Excellent. Delegate Solomon, you are not in the same world that I am, because you got a blue sky behind you, and I've got about 3 inches of snow on the ground already here in Mount Airy. So, but it's good to be here. We prepared a slide presentation. I presume that your staff has that to put it up. If not, I'll attempt to do it from this end, but I've been technically challenged in the past.
Sure. June, do we have a presentation?
Actually, yes. I'm sorry, Secretary Brinkley, we don't have a copy of it. Do you want to go ahead and email it, or do you want to share your screen with us?
Cindy, if you have it, because I know you're listening, I'll try to share the screen. It also has my notes off to the side, but they're just on one. Is the camera?
If you want to just go
working
ahead
now?
and email it to me, that would be fine.
And Cindy, why don't you go ahead and email it to her?
Okay.
And we'll see that this that way my.
Okay, I'm working on that now.
Okay. I apologize. I thought that we had that that you already had that in your hand, and
sure.
I just made some notes here so that I could handle my introduction appropriately. But while we're waiting for that, let me just say that I appreciate the taped messages from Miss Ekelar at MCI and Miss Suter from out in Hagerstown. And then since Miss Henson and I'm going to butcher the name. Miss Sargensen down at University of Maryland is here, but again, we don't have a lot to do with University of Maryland campuses, but it still is informative and helpful to hear their perspective. But to Miss Henson, I want to say that I'm glad you're recovered well, and I hope that your husband is recovered well. And I hate to hear any story of anybody getting any of this. My sister had a bout with COVID and came very, very close to losing her this summer. And we've had a couple people in the secretary's office with DVM where they or their family members have been affected. So it's going to affect all of us at some point in time and in varying degrees. Whether it affects our personal bodies or not remains to be seen. So I say that with sincere empathy and gracious that she and her family are seemingly coming through this okay. So, and in the meantime, I don't know if we want to go into a question before we go into the slide presentation I have.
So,
I'm also getting emails that pop up here, so I'm trying to clear my screen when you see me reach up.
So, I mean, while we're waiting on your presentation, I know that Delegate Valentino Smith had a question, and I had another from Delegate Henson. So, Delegate, if you want to go ahead and ask.
Okay, thank you. Sorry, I was having, can you hear me? I'm getting the
We can hear you. Yep.
Fine. Thank you, Mr. Secretary, and certainly always appreciate, I know, the sincerity of the effort the department has for the health and safety of its employees. So the original questions that I had that seemed to come from the presentations that we're hearing are, one, is the state using a particular health officer or committee to develop consistent policies with respect to dealing with COVID and distribution of PPE so that there's consistencies amongst all the state agencies, or is each state agency doing something different? One of the people testifying that thought it appeared that it's very.
And Cindy's in the background. She can fill in the gaps if I miss something. But what we have been vigilant about doing with this whole pandemic is, keep in mind that even the medical profession is learning week by week, and they're changing some of the guidelines as they go along. So therefore, our conversations have been principally through MDH, who have been in close contact with CDC in Atlanta with how do we deal with this. At one point in time, and I'll just give this because it's a big fiscal issue, early on, we set out to purchase an awful lot of ventilators because that was what the medical profession was saying we needed to do and be prepared to put people on respirators. Now, the thoughts 9 months later is not so much that we want people to be on ventilators. Some are. They now invert the patients so that they're on their bellies to help with some of their actions. And the medical community is also learning just as quickly as we are. Meanwhile, we bought a lot of ventilators that doesn't appear that we're going to be using. And even the federal government changed their guidelines on how we could use some of the COVID response money. They told us we could only use for the purchase price of a ventilator 20% of the federal monies. Why? Because we were going to be stuck with the ventilator for the rest of the time and it wasn't going to be utilized here. That's just an example of how some of the guidelines are changing in some instances week by week, and therefore we try to adapt to that. Having said that, as the umbrella, keep in mind the responsibilities that a department has or in an office environment might be different. So what corrections is having to deal with, because they have populations that live and cannot go outside the facility. Same with the health department with some of their facilities. The conjugate care, I guess is what they call it. They have a certain set of guidelines and thresholds that they have to follow versus the people that potentially could work from home or those that might have to come into the office. If we're dealing with someone at State Center where there's a high rise, elevators and things like that, that's one aspect versus if someone were to come to 45 Calvert, there's a different dynamic. And so we have to be responsive that DGS and the individual agencies can respond appropriately along those lines. Cindy, did I miss anything?
We have been dealing, just in terms of the individual, we've been dealing with Dr. Cliff Mitchell. You've seen him probably on many of the news shows. We've been dealing with Dr. Mitchell. And then my understanding is that they have some subgroups. They work with the other docs at like public safety and DJS and the health department to deal with any particular or unique situations with those particular facilities or agencies.
So, Mr. Chair, can I just press for a minute? I'm not understanding. So if I'm a state employee, well, actually I am, okay, I'm coming to Annapolis for session. Are you guys still there? Sorry.
There we go. Yeah, we're here. They got the slide presentation. Right?
You know, there's manuals and recommendations for everything. So if you're a state employee, there's not some place that you click that says, okay, if you've traveled to a certain state, do or don't come to work. If you are given, you know, information from a contact tracer, do or don't come to work. If you know, like that there's protocols for people to know if they should, standard protocols, if they should or shouldn't come to work. And then with that policy, what's the policy for them having to take their own leave, or if they've used all their leave and they have a work-related exposure, you know, because as you said, not everybody can telework. And then are they punished then because they had to come to work? So it's two things. Is there a policy of consistency for when people, what they should do if they're a state employee and they've had an exposure or travel? And what's the policy with respect to leave? Because I've heard from a lot of people that are being disincentivized to let on that they've had a contact because they don't have any more leave left. And they're going to get punished because they're going to end up on leave without pay, or they're going to end up having to use what might have been reserved to help take care of a parent, or to maybe, you know, in 2021 have a little vacation, but they'll be told they have to. So do we have policies for leave and policies for coming or going to work if you're required to be a state employee on a campus?
We do, and Cindy knows the intricacies of this inside and out far better than I could ever grasp. Cindy, why don't
Cindy
you,
always knows a lot.
I got to tell you, she's a wealth of information, and she's been there for years, and we really don't know what we do without her. And she's an invaluable member to the team here. And so I'm going to turn it over to her. Let's answer this question. We'll get to the presentation we then have, and then we can go back to some more questions, particularly if anything's not addressed. Thank you.
Sure. So thank you for your kind remarks, Secretary and Delegate. We have very early in the pandemic, we introduced screening protocols for all individuals entering state buildings. We had DGS screeners in place at all the facilities, and the agencies had their own screeners. So there was a series of questions that we worked out with MDH. So if somebody tried to enter the building and had any sort of symptom that was related to COVID, they would be turned away. So that was universal protocols that we put in place to ensure that sick employees were not entering the buildings. And it might have been things that they wouldn't even connect to COVID, but the screening protocols were asked of the individuals, and they were turned away. So we have the screening protocols. We also have universal, we were calling them reporting to work guidance, which I've shared with Jason. And this guidance, as the Secretary has mentioned, has evolved over the course of the pandemic as the CDC and MDH has changed this guidance on handling of individuals with COVID or suspected with COVID. So these return to work guidance has been given to agency HR directors. And to actually Lance's point about first line supervisors, that's exactly why we distributed only to the HR directors, because when employees report that they are sick, or a supervisor reports that they have a sick employee, I wanted to drive those questions to the HR directors that have the guidance from DBM, as opposed to having individual supervisors make different determinations based on their interpretation. We want the final decision to be made by the agency HR leaders in each of the agencies. And to your third question about employees who are on multiple quarantines, right now what we have in place is we have, of course, employees have their sick leave, they have all of their leave available to them. We have implemented the 80 hours of additional leave for employees who need to quarantine. So that's above and beyond any sick leave. We also have in place an advanced sick leave policy that we put in place very early on in the pandemic for anybody who might run out of leave. They can borrow against their future leave earnings. But more pointedly to your question, we are the issue that you've raised about people being multiple quarantined and burning their leave has recently come to my attention from one of the police unions. So we are actively looking at that issue. But right now, as it stands today, employees have their 80 hours of the emergency paid sick leave. They have all their state employee paid leave available to them, and they do have an advanced sick leave policy available to them. But we are looking at
and that's the benefit then, does that apply to all of the unions, all the union contracts that you have, or is it standard with all of, we've got different union representatives here, obviously. They have the same 80 hours of emergency?
Yes, yes, it was a universal implementation across for all employees in the state personnel management system and MDOT.
Yeah, so that had nothing to do with whether they were in a union or not. It was just something we're trying to do that's across the board.
And then for the hospitals, then they said they've been asking for some standardized process for all of our state hospitals with respect to testing, PPE, and leave. Is there a or is each hospital taking it on its own?
You know, I have not been extensively involved in those discussions. That's more of an MDH issue. But my understanding is that they did have through Dr. Mitchell that they were meeting and pushing out sort of universal standards. But I don't have firsthand knowledge of that. That was just my understanding.
Appreciate the answers. We're going to go ahead and move with the presentation and follow up with more questions.
And so, Mr. Chairman, thank you. And I appreciate your staff's indulgence as we were getting this prepared to get up. What I'm going to go over are basically 5 key points, but also in my introduction here, I wanted to thank the members of the committee for hearing us out and just maintaining this dialogue. Having a back and forth, I think, is healthy for everybody. It's healthy from our perspective to know what you're hearing. I will tell you, I've had one-on-one conversations with members of your committee, and I appreciate that when we can have a back and forth, because there's times that I get the opportunity then to share that with Cindy or some other members of my team, and it's good to hear what that is back and forth. As you know, Cindy is on the call with me if we have to get down into the weeds on any particular issue, and like I say, she is an expert. I also have Barbara Wilkins on the call, so she'll be monitoring things, and many of you know because she also handles a lot of our legislative affairs. And you might work with her one-on-one. In the past, coming up on session, you know, I was able to be freely walking through the building. That's not going to happen this year, and we have to maintain some new standards on how we do all of this. But you know, it's a dynamic that we're all going to be learning from, you, me, and all of us. So the 5 key points that we're going to go through in these next slides are the objectives. What did we as DBM see that we had to deal with as this whole thing first emerged back in January and February, almost a year ago? I'm going to go over some of the actions that we took and some of the early safeguards that we implemented. Now, Cindy addressed some of those in response to the question that we had. Then I'm going to go into some of the additional measures that we took, which go beyond the workplace environment, namely just from an employee perspective, because we do know, just as Ms. Henson had her husband affected by this, you know, there's a familial concept to all this. We've heard from a lot of people, most people, just on the pay incentives. We'll briefly touch on some of those. And then also the concept that we have with the employees, this delicate balance that we have between confidentiality and what do we do when an employee is suspected of infection or exposed. There's 2 different concepts there, but we still have to be delicate in how we handle those. And then the last slide will just be some contact information. I know that Cindy put her numbers and all that up there. So why don't we go to the next slide that we have. So in our objectives, when we first started this whole thing, again, none of us really understood what the magnitude of this was going to be, other than the fact we knew it was going to be very deep. You even saw that from some of your experiences during session, This was a learning experience that every day there was a new chapter and a new lesson to be learned by all of us. So our overall mission was to keep employees and the clients they serve safe, depending on whatever venue that came to be. Those clients are certainly the taxpayers of Maryland, the people that had to come to the MVA, the people that have to come to any Department of Health facilities, people that had to come to the legislature to testify. Our mission was also to minimize the spread of COVID in the state facilities and the buildings that we had dominion over, that we had control over. Our overall goal was to minimize it through our whole community, but to the extent that we could control some of that in our buildings and our facilities, that was our goal. Maintain the continuity of state operations. That's where you saw the governor take on an awful lot of actions through executive order. For instance, no licenses. If you had a professional license, it would not expire during this. Our driver's licenses were able to be extended until we could get back in to some of the facilities and have that back and forth. And yet we also had this long unknown was, what is it going to cost? What's it going to cost, not just for the state to deliver the services that it has to do, but also there's a cost on the other side, which is Maryland's families. What do they have to deal with? And yes, we just had the Board of Revenue Estimates meeting last Friday where we wrote some of the numbers up, but they still are down from where we were in March. We start to see that there's a light at the end of the tunnel. We all are praying that it's not a train coming the other way, that it's a vaccine that's hoping to get us back up to where we sense there might be some sense of normalcy. But we also realize that it's going to take a year or even more to get back out that far. So let's go to the next slide, please. So some of these actions were taken very, very early to protect the workforce. December 27th, we issued the pandemic flu and other infectious disease policy. There was one that existed. We had to clean it up to deal with this virus and so many of its unknowns. We had to go back and forth, get the governor's legal counsel to go okay on this, and then try to identify the best mechanisms to handle this. Our mission was to facilitate any containment of the pandemic flu, but also, again, still trying to keep some type of operations going forward. On March 5th, the governor declared the state of emergency. It's ironic that the next bullet point is March 13th, we moved to level 2 flexible operations. The reason I say that's ironic, you all were still in session, and I, as Secretary of DBM, had instituted an internal exercise for March 12th. That was a Thursday, where I mandated everybody at DBM work from home and see how it goes. Take the computer and the equipment that you have and let's see what's going on. Let's try to identify some of the vulnerabilities. And ironically, the next day is when we moved up and told people they had to stay at home. Now, also, while I'm on this bullet point, believe me, I don't pass out accolades very frequently. That way, I think when I do, they mean something too. But the Department of Information Technology really, really, truly stepped up in trying to identify hardware that was on the market, that was available, so we could get it in the hands of state workers. This took a few months, and in some instances, we're still trying to play catch up. But that was a very impressive rollout of getting the technology in the hands of the people that could work from home to get them to keep going. In many instances, they use their own equipment at home. Well, then DO-IT had to step up on some challenges dealing with, how are we dealing with internet security and all. And I don't have the answers to those issues. I just want to tell you or point out that they really stepped up the game and were able to move it forward. While I'm on that same bullet point, Cindy provided me this data point because I think this was a question maybe half an hour or 40 minutes ago, that on, in January from our Workday tags, you all are aware that we implemented this new software system, Workday. We're the only state that has it. And I got to tell you, it has been phenomenal as we've gone through this. And we're hearing from other states wanting to know, how well did this work out? But from our Workday work tags, which admittedly at this point in time was imprecise, we had 1,034 teleworkers in the state personnel system. And that excluded MDOT. Now, I think the numbers that we're working off of, we have in the neighborhood of about 47,000 PINs that are not university system and I don't think they're transportation, Cindy, you can correct me, maybe they are. but we have about that. So we had 1,034 in January. By comparison, in October, our agency survey revealed that we had 20,814 people working in a telework environment, a significant increase. Now, as we prepared for this hearing, I queried of Cindy, I said, well, what's the definition of someone teleworking? Because for instance, I know that my budget analysts work very well from home, but like Mark Nicole will work from home, but then he's also in the office, and I go down to the office periodically, especially if I have to meet the governor or if there's something going on down there. So I'm doing this from my home now. So what's that definition? And I think, Cindy, correct me if I'm wrong, but your definition was that they had 50.1% more of their time as listed as working from home versus 49.9 perhaps in the office. That coincides with some of what we recommended to some of the agencies is if you do have situations where people have to come in, there's either mail that can't be scanned or can't go through, or the systems are such a secure system, or more than likely an outdated IT system that they had to operate the computer. Structure the time so people didn't have to be on top of each other. And that's where some people would come in one day, some people maybe 2 days, and then they could work, take care of emails and everything else remotely appropriately. And that seemed to have worked very, very well. So basically you can say that close to half the state workforce is working in some type of a teleworking environment. And to this day, we still have some people that are not able to do any of that. And we have not laid those people off. We have not fired anyone along those lines. And I think we're down to 0.3% of those individuals are on administrative leave. And we're trying to work through exactly as to how we can ensure their productivity. Cindy, I ran through an awful lot of facts there based on your email that you sent me the other day. Anything that you need to correct or modify on what I said?
Nope. I think you did a good job. That's it.
Okay. That was the bullet point around March 13th, because we did this test and we never even got to deal with the results because the state was thrust into it on the 13th, Friday the 13th. So while no operations were closed, premium pay, which was double time and a half, was paid to those essential workers who had to report to offices or facilities until safeguards were in place to protect the workforce. And this is one item that we've heard an awful lot of complaints about when this came back. Why? Because DGS by that point in time had some way to wrap their arms around screening, ensuring that the facilities were capable of doing some type of sanitization, at least as we knew it at that time as to what they had to do. And, you went through, the MBA was shut down, well, then people could start to come back. And again, this has been an evolving process as we try to ensure those state operations, but primarily also ensuring the safety of our workforce and their families. Next slide, please, I think deals with some of the other parts that we did. So early and ongoing safeguards, we had only the essential people allowed to work to the offices and facilities. Everybody else was required to telework. Those who were not emergency essential and couldn't telework were given administrative leave until those barriers could be resolved. That's where I pointed out that do it. And I've told Mike, and I even said it in a cabinet meeting, that they really were above and beyond, and especially with the supply chains. Keep in mind, they were trying to get some laptops and computers, and everybody was getting laptops and computers, and literally we couldn't get some of those to come in. Department of Health approved screening protocols that were put in place in offices and facilities. Look, there was a training process there too with some of the guards that we had to implement in place. And to this day, when I come to the office, I get asked the questions and I get my temperature taken. MDH approved the reporting to work guidance and FAQs that we had to have provided to all agencies to ensure that what we were doing was universal among all state employees. And as we learned, yes, we made modifications to them. And then Cindy and her team in particular had to provide guidance to the HR staff. And this was very key, because as much as we might like to be able to know that the person across from us, was sick or something like that, whether you like it or not, we have HIPAA to conform with, and we have to respect everybody's the confidentiality of their health information. And there is something that we have to take that guidepost there. That's why it's so critically important that we have contact tracing, a successful contact tracing system set up, but it's not just among state employees, it's among the whole citizenry. And so if somebody is, pulls that they come down, that they're sick at work and they go through the contact tracing, there should be an opportunity there for employees to be reached in a secure environment, whether they're an employee or whether they're just someone that they maybe went to a restaurant with or had some type of retail contact with or a social contact. And again, we're finding through contact tracing, the vast majority of these community spread infections are not done through this type of an environment, especially when we have the protocols and the technology and the materials in place to ensure sanitization. Not to say that it never happens. I'm not trying to go there, but it's where people let their guard down and then are more in a social environment that they have those challenges. Next slide, please. Thank you. Just a second, please. This first part goes to the computer security issues that we had. So this was dealing with the multi-factor authentication for Workday. I don't know that legislators have access to Workday. Cindy might tell me, she might nod her head or not. That's whether they have to do the same thing. I knew that for benefits and all. But the key is, and to me, it's a pain, to get that text message to key something else in. But that is another added layer for security as we had people not necessarily coming in and using computers at their desk behind that firewall. All DBM vendors, including the benefit plans, were required to produce continuity of operations in early March. We typically have done this every year. Usually it's done around the thought that you have a hurricane or that you have a snowstorm like what's going on outside or something like that. But we made them all dust this off and ensure that internally we could operate. We had new lines of communication, but also if we rely on an outside contractor, that they too can deliver what we need. We are requiring employees to wear masks in buildings and facilities. You all see that, you all know that, and there's a big controversy going along as people are out in public, but not if you're in a state building. Wear the damn mask. Required agencies to put social distancing and cleaning procedures in place. When you go into, I know the men's room where the secretary's office is down at 45 Calvert, they've got a little plastic thing that you're supposed to not even touch the doorknobs. And how many people are using paper towels to turn the doorknobs, and then still, make sure that you have access to alcohol preps and all that. And I would encourage employees. I know that you're going to ask me, people that are listening, and all the other unions. When you see a restroom that's not up to par, no one can do anything about it if they don't know about it. Let DGS know. The new, with the contracts that they have, if they're not our own employees, they are required to step up the pace and make sure that those things are safe and secure for the people that are coming in. Close any common gathering and eating areas in buildings. Generally, I would suspect that's been done. I know in our area it's been done. And then also revise telework for some of the telework options. I have to tell you that teleworking capability prior to this was very hostile toward employees in having them do that. You saw only 2% had been doing it before, and we require it, and it almost was insurmountable. And now I think this is more cognizant of today's workforce. I've heard it said about, Cindy's going to freak out on this because it's not in the statements here, but my team always hates it when I go off message. But in the retail things where you see so many people that were buying things from home, what's happened is these things were going to happen anyway. This virus accelerated that type of pattern or behavior, perhaps from 10 years to, in this case, 6 months. We were eventually going to get, because it's more of a work friendly where we can have that type of access to people. And now this forced us to have that type of telework, so that someone now doesn't have to do the 8 hours back to back. How regimented is that? Now, yeah, we want the 8 hours. You got 24 hours to do it in. We don't care if there are kids in the room. We get that's going to be part of the environment. Cindy, what else is? I know you answered that in one of your questions, but this is a major change to the bureaucratic pillars that this state had operated on, and this virus required us to make this shift. And we are also, Mr. Chairman, I'm telling you that we're also having those conversations with agencies as we're moving forward on the budget is tell us, are your square footage requirements really accurate now that we have the technological capability and the securities in place to enable people to come into the office 1-2 days a week or whatever? Because I suspect a large form of this is going to survive the end of this pandemic. Cindy, anything that we need to add on that?
Yeah, I guess I just really want to emphasize, I've been around the state for a long time, that the secretary's comments about the telework not being very readily accepted by state managers. I mean, we did a 180 really in a day in the state. We went from everybody working in the office to, sorry, that's sorry. To everybody
wouldn't be a meeting without somebody's dog.
I know.
Sorry, that's mine. To everybody teleworking, or 50% of the workforce teleworking almost the next day. And it's just been a phenomenal sort of transformation. And our interim telework agreement is so flexible. We allow employees to work whatever schedule they want, as long as they get their 8 hours in within a 24-hour period. So I think that's incredibly flexible and forward thinking, because we launched that right at the beginning of the pandemic, and it's been relatively unchanged since we've gone forward. So that's it.
Good. Thank you, Cindy. And keep in mind, we've had some people who say, well, I do need to come in and get some documents, or I do need to be physically on site for some reason. But I don't need to be on site for 8 hours. And there's no community lunchroom. There's none of that going on. So they might come in. I know that my fiance has, with her Board of Public Works, there is an employee who walks to the office every day just to check the mail, make sure no legal documents have come in, because there are legal thresholds and timestamps that have to be done with that. They get checked, and she walks home, and she can handle the rest of it. And she does it because that's part of her exercise process. But that's unique to her. She lives downtown Baltimore. That's where the office is. And yet I think that and yet there are certainly some people that don't have that advantage. And we're trying to be cognizant of that too. Cindy talked in regards to that last question, the new advanced sick leave policy to protect those people who do run out of leave so that they can advance some of it. While we're on this, I'll point out that we also ran into an issue with some of the Department of Health people, where some of those employees don't get cash overtime. They do earn, Cindy, what is it they earn? They earn annual leave, or what's the correct term for it? That we extended by 24 months. They had 12 months to use it or lose it.
Comp time,
the comp time. I'm sorry. Yeah, the comp time. So we unilaterally extended that they have 24 months to do it. We don't know how much longer we're going to be in this environment. We certainly acknowledge that they're not going to be able to burn it all at that point in time. And at this point in time, honestly, the Department of Health is having some burnout issues anyway. And so we might have to be revisiting some of those issues, because that's how they earn some of their overtime. And then we eliminated some of the documentation requirements for some of the use of sick leave for any flu-like illness. It used to be that you had to go in and get a note from the doctor. It felt like, and that's just not, it's not tenable, and it's not realistic in this current environment. Will we go back to that? Maybe at some point in time, if there seems to be a major abuse of this. But for now, this is, I think, something that's very friendly and accommodating. Our challenges are still just making sure that we have the bodies to do some of the work that needs to be done, particularly when they're on site. Next slide, please. So this is something that we went, I think, above and beyond, and this came from Cindy and her team, and I thought it was brilliant to do. We unilaterally went out and told our contractors that we have with the prescription and everything else to extend early prescription drug refill authorizations. We don't want some of the bureaucratic holdup that, it's only 90 days or whatever it is. Look, if someone like I use insulin as a diabetic, they had to go ahead and not just stop at the 90-day prescription thing, because we didn't know what the supply side was going to look like. We didn't know whether people were going to have access to some of these things. And we didn't know that if people had to quarantine in their homes, that they wouldn't be able to get out to a pharmacy. For telehealth services, we waived the copay for that because obviously that's where a lot of this was going. And then the 54 flu vaccination clinics. You've heard a lot of people talk about, you know, you got to watch out because COVID and the flu look an awful lot alike. Well, we set up clinics. Cindy, where were they? There were an awful lot of them at the corrections facilities, but we even had one, I think, in Annapolis, and employees. Was it employees or just about anybody could come get a flu shot?
I think we were targeting mainly employees.
Mm-hmm.
Don't have all the locations. I think we were mainly in facilities where we had at least, I think, 30 people that might be eligible to get the flu or interested in get the flu virus vaccine.
And they were also targeted, I think, specifically at some of the, since they were corrections and I think some of the MDH facilities and all, where people had to show up. If they had to come to work, look, let's bring the flu shots to them at work to try to help out with getting ahead of that. We waived all medical fees associated with COVID tests. Me, I've had one test. Like I said, my sister was diagnosed. Didn't know at the time when I visited her. So when I had my test, you know, went through CVS and got all that done. I know that some people in my office, literally the DGS parking lot over in Annapolis was doing testing and they didn't even get out of their cars. They swabbed them. And I know the one person got a negative test like right away. I guess it's a PCS test or something like that. And then we required all of our benefit providers to increase access to telehealth and video services for any type of visits that they might have had to have. So that was good. We then put the brakes on any out-of-state travel. Now, as department secretary, as DBM secretary, I have to sign off on any out-of-country travel. In this instance, I did hear from some agencies that requested exemptions to this, and I granted a few of them. I didn't grant all of them. For instance, the fire marshal, I think, had bomb dogs that had to have certification, and there's only one facility, I think, in Alabama that do that. So they were going to take, you know, Maryland vehicles, drive down, get the certification, and come back. Or maybe that was Denver. I can't remember exactly what that was, but we were very, very restricted in that. Another exemption that I know that I made was for DNR, where we are in a reciprocity agreement with firefighters for fighting forest fires. Well, you saw what happened out west, and we did send a team out to fulfill our obligations under that. But I think other than that, I think I turned down 90% of the requests that we had. And our mission was to keep, whenever possible, someone that didn't have to leave the state to stay in. We had requests from some law enforcement agencies to attend funerals for law enforcement people that had fallen as a result of COVID. No, as much as I am supportive of law enforcement, and I would certainly love for us to be able to pay those respects, but in my opinion, we didn't need to risk sending a trooper and a vehicle out of state for what is, while it's honorable, but it still is simply ceremonial in that regard. And there might be an opportunity later on for us to pay those respects, but I use that power with great discretion. The next slide, please. So this is where we get into some of the pay incentives that we implemented right away, the premium pay, the double time and a half. And believe me, I get it that people love getting it, but we were also looking we didn't know the length of how long, you know, the costs of this whole thing were going to last. So before we knew that the protocols were in place, number one, we had to ascertain A, what were they, B, communicate what they were, and then C, make sure the material was in place to make sure that happened. So we ended up paying over nearly $40 million in pay to employees who had to report to work in that regard. We then crafted this response pay. Cindy, I think you modeled it on what you'd learned from another state. I'm not exactly certain which state it was, but our challenge was here, particularly when you had correction officers and people like that, they had to show up to work, or you had to have management, you know, say, look, someone's not reporting, you just completed an 8-hour shift, you got to stick around. So as an incentive to make sure we had people come, but we also didn't want it so high that there was an incentive to ignore symptoms. And we felt that this struck that balance. Honestly, I think the threshold for this came from was it Baltimore County or Baltimore City implemented something similar, and Baltimore City implemented something similar, and that's where we got the threshold for how much we would do on this. We knew the protocols were in place, and I think this was very well received. Once a person showed up at work and had duties, if they were then assigned to a quarantine role, for instance, in a correctional facility, and then there was a pod set aside, because I know that Rob, Secretary Green, had set up that if, again, he didn't really know what he was going to be facing. If we got cases in the correctional facilities, let's establish pods on the side that were like negative pressure and everything else, so that we tried to contain this as best as possible. That person who was then assigned to those quarantine facilities then received an additional $5.13 an hour over and above what they were paid. So there was an additional $8.26 an hour for that person who showed up. Pardon me,
Secretary. No, it was $5.13 total. So they got the original $3.13 plus the additional $2. So it's a $5.13 total for working in a nice ward. Yep.
I stand corrected. You're right, and I apologize for that. But the key on the quarantine pay, while the response pay then went away once we determined that we had the technology and the capacity set up to properly screen, and we were getting, there was an adaptation. People started to feel secure in what they were doing as they came to work. We still had people assigned on the quarantine pay, and we are still paying that quarantine pay to this day, and will continue to pay it as those individuals keep going on. So Cindy, I know I butchered the one part. Anything else that we need to correct on that? Feel free.
Nope, I think that's good.
Okay. And Mr. Chairman, we also, while we didn't know this at the time, we implemented this blind as we moved forward, but we then determined that we could utilize some of the federal CARES Act money to reimburse for this aspect. So we did. That's part of that type of accounting and all. And once we got the permissions to basically do some of that, that's why some of the dire numbers that we had early on when you all had recently adjourned started to improve. We were identifying areas where we could qualify some of those expenses for reimbursement, and it helped offset some of these costs. Now, that runs out on December 30th. We're going to continue to do that quarantine pay beyond that point in time, just while we have this challenge. We might get something else out of Washington, but we don't know what. We don't know how much. We don't know the rules that are going to be with it. So we have to move forward, presuming that there is nothing else coming from Washington after December 30th. Cindy, anything to add to that?
No.
All right.
Thank you. I have been temporarily deputized chair. The chair had to step away for a minute or two. Might have been that big microphone in his face. No,
there you go.
Okay.
Perfect timing. Was that almost perfect timing?
We were just at the end of his testimony, Mr. Chair.
Excellent. Question.
We're wrapping it up. Let's go to the next page. I think it's the last one. I just wanted to just touch base on this because this is a key to a lot of it, the employee confidentiality. It's a balancing act, and we're going to abide by the rules and the laws of what we have to deal with. And I get that causes frustration on everybody's part, but we're not going to violate an employee's confidence along those lines. So, Cindy, anything you want to add to this one? I didn't read it to him, and I didn't get off on any stories like I normally do too.
No, I think it stands for itself. I mean,
that last bullet point I think is key. We don't track the diagnosis. We do track any leave that there might be. We don't ascertain what the cause of the leave is.
Right, and we've gotten a lot of questions about does DBM universally track these cases, and we do not. We think that the information, the personal health information of employees and the handling of these cases best resides at the lowest level, at the agency level, through those agency HR managers and directors that I referred to earlier, recognizing that they are handling the cases with the universal guidance that we put out from MDH.
Okay, last page, I think. All right. Well, this is again. I'm trying to be cognizant of our time. I've given you that, and there's Cindy's contact, and I think most of you also have my contact information. It's not on the page here, but feel free to reach out to me. I guess that is my number down there in the lower right corner, at least the front office number.
Great.
Mr. Chairman, I apologize for taking so much time, but I appreciate the opportunity so that we could explain some of what's going on, and my conversation points will try to fill in some parts between the bullets and not just read to you.
Sure. And I know we have some questions from the members and some things we want to communicate. We have a guest from Appropriations Committee, but not our subcommittee. Delegate Henson had a question. Shanika Henson.
Thank you, Mr. Chairman. Are you able to hear me?
We are.
We are.
Thank you. Thank you, Mr. Secretary, for the presentation. In the interest of time, I will delay making any comments about my commendations to the state for pivoting in such a short amount of time to the telework model and all the different things that you outlined in your presentation that I'm sure.
We like compliments. If you want to do that, go ahead. We don't
Take as much time as you need.
My question is simple. That with all the recent changes and the things that you're doing to keep employees safe, a lot of the stories that we're getting from employees are the challenges. A constituent of mine testified today in the testimony about the challenges. And I'll say that she kept it very personal to her experience, but the MVA in Glen Burnie was classified by the Anne Arundel Health Department as an outbreak with the coronavirus cases and diagnosis there. It wasn't limited to just one employee, there were several. And so with all the different changes that you have, I'm getting from your testimony that you prefer to have the policy decided at the executive level and then implemented at the agency level. But where is that quality control measure? Some of these things are quantifiable. If we're doing universal testing, should be able to look at through the purchasing, how many test kits are we purchasing and what's happening there? Some of these things should be able to be managed at some executive level if we're just looking at and following the numbers. So my question is, what are we doing to quality control when we have such great plans, but we're getting feedback that these great plans are not always implemented with fidelity?
Well, I guess the key thing I have to say is if you do have somebody that sees something that's not right, and I'm not talking about the MVA thing. I did mention that earlier, that if you see something that's out of place, if they're not properly screening people, no one can fix it if they don't know about it. So I think it's incumbent on all of us, me, you, whoever, to raise that. So far as what the definition at the MVA is of an outbreak and what they've done about it, I don't have any details on that. I don't know how the secretary over there has set up his retail conversations or establishments to deal with that. I do know that early on we were looking to them as a model because they have to have retail. Not all of our agencies have to meet people face to face. Some do. And so he had gone through some extensive changes to deal with that before he even brought anybody back in. But we'll have to find out what the specifics are at Glen Burnie MVA as to what and why that became an issue. And I don't think it'd be the only particular issue or instance. Any other instances, we had the tragedy down in Prince George's County with a health officer. And what I read in the press, I don't know exactly what's accurate on that, is that the person was prohibited from teleworking. I don't know the details on that. And then that person ultimately died. So Cindy, do you know anything about the MVA or anything as to how we handle if there's a large outbreak like that?
I do not know about the MVA, but I can tell you, Delegate, that the HR director for the MVA is listening to this meeting. And I certainly follow up with them after the fact. And we're contacted frequently by employees and other entities. MPAC has reached out to me with their concerns. And so we do follow up on those complaints. Now, we can't always guarantee that the resolution will be what the the employees like, but I think we have pushed agencies to think a little bit more outside of the box with regard to telework. And we did, DBM put out some additional guidance when we were returning all those people on admin leave back into the offices to make sure that employees were engaging in proper social distancing, that they would have barriers placed up, that there were signage on the floors and in the elevators, that there were cleaning protocols in place. So we did put all of that out, and I'm happy to run down any concerns that are brought to my attention and follow up with the agencies.
And Delegate, I'll tell you that MPEC was very good about, MPEC is a different union, about listing specifics at certain facilities so that we could hold the agency's feet to the fire and say, you know, hey, look, they're saying this is going on. Oh, no, it didn't happen. Well, here's the specifics, and here's the proof that they're using. And, you know, when we have that, then we can go after it. And I don't mind going after, Cindy knows that. I don't mind going after people to hold their feet to the fire, because employees have the right to expect a safe environment, especially if they're then going back to their families. But conversely, employees also have the right to expect that someone who works in their offices is exercising due care in their social and their personal contacts outside, so that they don't bring it in. And so everybody have to use a little common sense.
Thank you, Mr. Chair.
Thank you for joining us, Delegate. I have Delegate Wendell Beitzel with a question next.
He just wants to know if he can come down and plow my driveway. That's all.
Yeah, well, I have my own driveway, Secretary Brinkley, and it's snowing really hard here.
It doesn't look like it over your shoulder. It looks just like a cloudy day. So.
Well, that if I could turn this around and show you out my window, it would you'd have a window.
Yeah, I got snow here too. So,
hey, first off, I want to just extend some sympathy to you. I think Ruth had whispered over my shoulder, if you got a Secretary Brinkley on there, I think the day was the birthday of your son, Ross.
Yep.
And that you lost to a drug overdose situation.
Yep.
So
lost him about a year and a half ago, and today would be his 26th birthday, and it's the last day I saw him 2 years ago. Thank you, Wendell.
And I know it's a tough day for you, and I know I just want to commend you on keeping your cool through all this. And as I was listening to the first presentation from the union's perspective, it would seem that there's not very much you're doing right there. And I imagine when you were sitting there listening through that, your blood pressure probably went up. But I know, you know, I served in the military during the Vietnam War. Unfortunately, I didn't have to go to Vietnam, but they sent me to Germany. And we kind of did what we were told to do. And we have to have leaders that we have to follow at times. And we had a tough situation here where I think if, and even like use an example, if General Patton would have had to listen to the privates over there in Battle of the Bulge, I think we probably would have lost the war. So I'm listening to your presentation here, and I just want to commend you and Cindy and people for in a very tough situation. And none of us ever expected this pandemic, and we're dealing with things every day that we haven't been accustomed to dealing with. And I don't want to commend you and the state employees. The state employees, predominantly have had to deal with tough situations. And so, but even though there was a lot of criticism there, I just wonder, it would seem like you weren't addressing any of those concerns. And I just a while ago, you had mentioned a few things, and I just want to ask you what process or procedure and what do you do when you get suggestions, from the union and dealing with these issues? And do you use some of those suggestions to do what you're doing?
Absolutely. Absolutely. I mean, when I get something that comes in, typically Cindy's copied on it, and she's already shared it with some of her team to say, hey, what's going on here? She might even reach out to the HR people to find out what's going on. And generally when things come at the secretary level down, I get that there might be a different response on it, but then we want some accountability. And at the same time, we've been able to say, in the case of, MPEC, here's what DJS was or was not doing. And here's, what's working in this regard, and here's what's not happening in that regard. Or, I can't fix it if I don't know about it. And so I think we've had a great back and forth with that. And when we have a group of employees and a union that can work in a professional capacity and isn't necessarily just about being confrontational and wanting to pick a fight, we're able to come to some of that. But a lot of this in some instances is posturing. But that's why, when I heard from Ms. Henson, I want to acknowledge it. There's people that are going through some challenges here. I mean, we might have management and union, controversies back and forth, but that's fine. But at the same time, we all still serve the same people. That's the citizens of Maryland. We have to use their money to do it. You've heard me say it when I was in the legislature. Right. It's OPM. It's not Office of Personnel Management in Washington. It's other people's money to do all that stuff. And we have to make some tough decisions, and we have to balance things and certainly balance the public good. But I appreciate it, Wendell. Cindy, anything you need to add on that, how we handle when we get some what we think are like legitimate back and forth, and we got to have them documented. Just an accusation doesn't help.
Right. Yeah, I think when we get feedback, we as I said, we do run it down. And I do want to say early on, we had extensive meetings with AFSCME and MPEC, and we did take some of the suggestions that came out of those discussions, and that was part of the reasoning for the building protocols that we put into place right very from the early outset. So the things that the secretary detailed about what we jumped out and did early on was partly as a result of the discussion with again AFSCME, MPEC, AFT, and so we did have good ideas come out of those negotiations. We don't always go as far or as much as the unions would like us to do, but we are willing to listen. We can't always do everything, but yes, if there's good ideas, we try to implement it.
And I don't pretend to know all the answers, but yeah, if somebody's got an idea, I want to hear it.
Thank you. Thank you, Delegate. And we have a question from Delegate Jared Solomon.
Find the unmute button there. Thank you, Mr. Chair. Secretary Brinkley, thank you for being here and
get your suntan lotion on. It's kind of bright behind you there. So.
I was going to say I'm going to channel the nice weather, and you don't want to see the guest bedroom with clothes on it behind me. I guess I had a couple of questions, and I appreciate you all being here. And I do also want to just thank all of our frontline workers that are here as well. Thank you for your service and has what has been an incredibly difficult year for everybody. So I guess my first question, I just wanted to ask the clarity is hazard pay continue to be offered for employees right now, or are we only if you're in those very special cases that we mentioned? I may have missed that, but I just wanted to ask a point of clarity on that.
It's not. It's only if you're in the quarantine setup. Cindy, anything you want to add?
Nope, that's exactly right. Quarantine pay is in effect.
So I know we had a conversation with, I think, the university system at a hearing earlier in the fall about reinstating that. Is that something that you all are thinking about reinstating or bringing back?
We don't see the need to it at this point in time. I mean, if we end up with some major challenges, staffing challenges going forward, then maybe we have to. But right now we're still trying to deal with the fiscal impact of all this stuff. I get. I got to tell you that 98% of the emails I received from AFSCME members had nothing to do with safety. They had everything to do with more money. We want response pay. I want this. I got to tell you early on, and it was actually kind of comical. Someone saying, I should be entitled to the response pay too. I pulled the person up in the computer. The person was a correctional officer. The person was getting it. And so there was a market push to just inundate, that we need this extra pay. When I get something that has some details on this department isn't following this spec and I feel at risk, Cindy knows, she gets it right away and we follow up on it. And that's why MPEC's, honestly, MPEC's letter delineating boom, 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 boom was very helpful, I think, in trying to resolve some things. And that's the best way. I want people to be safe at work. But at this point in time, we don't see the need that we need to extend that. And you saw the governor's release today where he's authorized, because of the new Board of Revenue estimates numbers as of Friday, he's releasing COLAs to the negotiated COLAs that we had worked through. And so in that context, everybody's going to get their a little bit of an increase come January 1st.
I appreciate that. I think we'll just agree to disagree. I mean, I think those of us that have the privilege of being able to, work from home and not have to interact with the general public, I know we're in a tough budget situation, but I think we'll agree to disagree. I appreciate the candor on that, though. And then I guess, another very quick question. I know some of this is at the federal level with the family medical leave and the extended paid sick leave that expires on December 31st. Is there any thought at the state level of extending that if the federal government doesn't move?
On what, the family leave or
the family leave and the emergency paid sick leave that the feds had put in place earlier this spring?
Cindy, is that anything along your realms? I'm not.
We are, that's along with the Delegate Valentino Smith's question earlier. We are considering that, but there's no final decision on that at this point.
Okay. And then the last question I had, and thank you, Mr. Chair, for your indulgence. I guess it sort of goes to the question of consistency, and maybe you sort of already covered it in just they should report it directly. And maybe this is sort of wrapped into, whether you're considering negotiating the telework policy, with AFSCME, which I think, frankly, you should. I think it should be part of the bargain system. But I think, I would echo what Delegate Henson said. I have heard, so many stories from people that say, and I think some of it is, you made a very quick change and it has not trickled down always to frontline supervisors. I mean, I will say I've heard a lot, particularly, my other role on the committee, I'm the vice chair of our education subcommittee, and I hear a lot from the higher ed folks that, certain departments in certain schools requiring people to come in when there's no need for it, and I get it, again, the change was made very quickly, but is there anything that your department is doing sort of, again, I hope that we could bargain it, but in the immediate term, to reach out to different agency heads, to different, different supervisors at different levels to sort of check in or hold them accountable of, are your employees actually teleworking, or is it just sort of one-off when you're getting the emails from people? And is that what we should just tell people whenever, Selena is having a problem at College Park? She should not only be emailing the people at College Park and emailing us, but she should be emailing DBM as well. I guess
No, she shouldn't, because we don't handle the university system. She can handle it internally there. We don't deal with the university system. Right.
I mean, she can email us, but the other folks on the call as well. I guess that's.
I get it.
Are you implementing an oversight system?
Cindy, why don't you touch base on how the negotiations this past summer went? Because we approached the unions about negotiating, and we had success with, if I'm not mistaken, 3 out of 5 unions. Why don't you talk about the history of that?
So we negotiate, but these were cuts to fiscal 21. We were able to reach agreements with SLEOLA, the FOP, and AFT. We were very unsuccessful at engaging with AFSCME and MPEC at all, really, about anything related to fiscal 21. So we haven't had a whole lot of success with productive negotiations with AFSCME. So they just haven't been very productive, but we are currently engaging in negotiations with them for a new MOU, and hopefully that we will be able to reach an agreement for some provisions in the new MOU.
Okay, and how about, I mean, again, just sort of overall consistency of how telework is being implemented across the board?
We DBM, for the agencies under our umbrella of oversight, it's about 64 agencies, and MDOT is following what we're doing very early on, we put out this revised interim telework agreement, which I did forward to Jason. If the committee doesn't have it, I'd be happy to send it. It's an agreement that all the agencies were to use. So it's all the parameters are right in there in terms of the flexible work schedules and working with childcare. So the actual implementation of the telework parameters should be universal. I think the rub comes in with deciding who can telework versus who can't telework. It's very hard for DBM to reach down into the agencies and say, you should allow these employees to telework full-time or 50%, because we really don't know what it takes to get the job done for the citizen. So we just continue to push the agencies. Our sort of slogan was, when people had to come into the office, was if they had to come in to get in, go in, do what they needed to do and get back out. And go back home and telework. If people need to come in and open the mail, get in and then leave. Don't stay there all day and check your emails, just get in and get out. The secretary, and I think he neglected to mention this, but during the recent internal budget meetings, my understanding is he and the DBM team, I was not in the room, they were asking questions of the agency head about how teleworking was going and about whether their employees were given the opportunity to telework. That was something new that we did this year. And again, we are consistently running down concerns from employees and the unions about stories of individuals not being able to telework. But often there's always going to be this disagreement between whether the employee thinks that they can stay home and do their job adequately versus what the agency thinks they need to do to fulfill the mission of the agency. So there might always, I don't want to say always, but frequently there's going to be a little bit of that disconnect.
Thank you. Thank you, Mr. Secretary. Thank you, Mr. Chair.
Thank
Hey,
you.
Deli. I think it might be helpful, Ms. Secretary, and even Cindy, just we've been dealing with these issues for a while, but I think the folks that are listening and even some of the folks that presented, you had mentioned how you all don't handle higher ed. You even mentioned about the Department of Health manages hospitals. And could you just give a breakdown of that for everybody that's paying attention? Not every agency you deal with, but which ones you don't, obviously. Who deals with the higher ed and the institutions, who deals with the hospitals, so we can clarify.
Yeah, the
that.
university system has their own, they have their own environment and their own personnel system. They might mirror a lot of what we do. They follow and they look to us for some guidance on some of their decisions. The second one, which is kind of standalone, is all transportation. Again, we have conversations back and forth, but they're all special funded. They've got their own sources. They have their own agreements that they have, and they have their own, negotiations and everything else. And I think just about everybody else does fall under us. Cindy, is there an exception to that? They're all executive agencies.
I just do want to clarify that while MDOT has a independent personnel system, they do generally follow what we put out much across the board. They are also involved in our negotiations. So we do not do anything with the university system, the judiciary, or the General Assembly. All of those entities are sort of standalone. I think a lot of them do look to us about what we're doing, but we have no oversight authority over any of those entities. With regard to the hospitals, that's squarely at MDH, the Maryland Department of Health. And as I mentioned earlier, I believe that there is a sub work group working on universal protocols and policies for the hospitals. And I'm very surprised to hear that there's the thought that doesn't exist, but
yeah, well, when I hear the term hospitals, I guess there are the state hospitals, which are relatively few,
Mr.
and
Chairman,
then
I have to
maybe
jump
somebody
off.
else. Okay, Wendell.
Stand by.
I have to jump off. I'm sorry. I got another Zoom I get on. Thank you, everybody.
Thank you.
Thank you.
And I don't know if they're referencing like the University System Hospital, Johns Hopkins Hospital, the other nonprofits that we have, Frederick Hospital, Washington County. Maybe they're discussing some of them. I don't know.
Sure, and I understand why. That's why I wanted to make sure that you clarified exactly where we're talking about. Because I think when we're talking about these stories that we hear, and I worked in higher ed for 6 years, and I hear from folks, and even our caller today, or Selena had discussed, what you're talking about in terms of a policy might be mirrored by the higher ed folks, but it's not mandatory that they do so. But you also talked about, and I'm thinking about the future here, the shift that you all had to make from everyone working in person to telework. And this might be even an abstract question, and I'm just thinking about the future here in terms of how we think about work. I mean, with 20,000 employees now teleworking, have you seen productivity go down at all?
I can tell you from my perspective, hell, I put more hours in. Now, granted, I can take a break and walk outside and clean the yard if the dogs have been a little overactive. But then I also find that there were times I was making calls at 9 o'clock again. From other employees. Cindy, I don't know if you have any feedback. I know that Cindy's been working from home, and God knows she and I were on a call this morning at 4:30 as we were dealing with the weather and trying to make a decision on closure or liberal leave and all of that. So just the fact that people don't have to drive into work, I think enables, in my opinion, a lot of productivity.
Sure.
I've always objected to the industrial time clock perspective, and from my business point of view, I had a business coach that steered me away from it to just do things that were productive. But the 9 to 5 is just not that's not the future, and yet we're kind of stuck in that as a bureaucratic model. And I get that there's negotiations and all that.
And I see Cindy looked like she was about to answer something. I just want to add into that. So we're thinking about the future and moving forward. And even that you're saying too about open to this different model. What you have internal MOUs, guidance, even changing of some of the policy. Moving forward after this calms down and we move back to a normal work environment, is this permanent? What's permanent? What's not permanent? What if let's say a year from the end of the pandemic, are we going to have the same issue where someone's like, listen, I got to watch my kids. I'm going to be productive. I'm going to work my 8 hours. It's going to be from home. What has been done that's going to be permanent for that worker, for that state employee, that's already been proven over the last 9 months, and it's going to be longer, that they can be just as productive, to guarantee that, one, they have a job and they have the flexibility to do these things from home? Are these permanent, or are they just temporary fixes?
Yeah, that's a great question, and I think it even drills down to each job. Which skill sets in a certain role will end up being permanent in that regard. So I'm just looking at DBM, looking at my team. The budget analysts, there is a certain amount of interaction that they have to do together to share information. But yet there are other times they can do a lot of the analysis from home. Earlier when someone was talking, I was thinking of an elevator inspector at DOL, where in the past they might have done the elevator inspections, then come back to Department of Labor to do their reports. Maybe they don't have to do that. They still have to leave the home to do their job task, but they might be able to do some of the reports, from home using the laptop that they had. But going the step further, Mr. Chairman, what I'm seeing, and not just in the state government, in the private sector. Yes, this is a new way of doing things, and the private sector has adapted to this, I think, long ago. But when you force people to stay away from a common environment, the people that are harmed by that are the newer employees, the people who don't have the experience necessarily to learn from someone who's been there a while. It's being able to share wisdom. You don't necessarily share wisdom over a Zoom call. And that's just an education aspect. We're seeing that with the schools now. But from a productivity point of view, I think that there are certain job skills in the state that we're going to be able to maintain this, but certainly not all of them.
Cindy, did you have something to add?
Yeah, so just from a productivity standpoint, I want to say I've heard very little complaints from agencies about drop in productivity. I have heard that agencies, if they have an employee who is not a productive teleworker, they want to bring that employee into the office so that they can have eyes on that employee. And what we universally tell them is no, you're not bringing somebody back into the office just so you can watch them. If they can telework, they should be teleworking. And you as the supervisor need to figure out how to get them to do their job from home and do the deliverables that you expect. So, and with regard to the ongoing change as it relates to telework and the flexibility, I think we as a state are going to be looking at as an additional recruitment and retention perk to help draw additional employees to the state. So while I'm not it's going to be exactly what we have today. I think it will be close, and I think it will help with some of our recruiting, because people are they're going to get the
Sure.
used to that flexibility, and they're going to want that.
Sure. And I appreciate the feedback. And I think that for my colleagues too, what we're going to need to think about is making universal telework policies so that we don't have this disconnect between higher ed folks supervised by DPM and such, so that we have a standard going forward, so that we don't have these stories coming back and forth about it's implemented here, but why not here and here and there. I, as the chair, need to keep track of time, and it looks like we're over a 4, or we're at 4 o'clock, but I was going to let Delegate Valentina Smith ask one final question.
Thank you, Mr. Chair. I'll be quick, so I won't be able to give all my kudos to Secretary Brinkley and Cindy. But look, this has been very helpful, and we're going to be in session sooner. So we look forward to making sure collective bargaining is working on these telecommuting guidelines, and that they are productive discussions. So Cindy, if you could just follow up with me. I got lost a little bit in the contact tracing, and if you could send us what the policy is for, is it HR that's reaching out and doing contact tracing? Is it supervisors that are reaching out?
Health department.
Or is it being all delegated to just the health department and the contact tracers? And I know we're short on time, but I'm being told that there's some inconsistencies in maybe the application of contact tracing and communication to employees. And also there's some inconsistency in testing. Some places are doing it weekly, they're doing it monthly. And I know we're up against time, Mr. Chairman. If we could just, from you, Cindy, later understand what are the policies, and if there are inconsistencies or not, why.
Okay, so you want me to follow up in writing to you?
With contact tracing and testing, because I don't think we're going to have time for an answer, right, Mr. Chairman?
Yeah, I think we're at 4 o'clock. I want to make sure I'm respectful of everybody else, but yeah, can you follow up with us, Cindy?
Yes, I just want to say quickly, contact tracing, I'm sorry, the testing is handled primarily by MDH, but I will follow up about what happens with contact tracing for state employees.
Great. Okay, everyone. Thanks for participating. These conversations, especially before the session, help benefit all of us moving into it. Mr. Kilpatrick, Selena, thank you for joining us and sharing your experiences. Denise and Secretary Brinkley and Cindy, as always, appreciate your information and the work that you do. And we'll be talking soon. Thank you all.
Mr. Chairman, thank you. Merry Christmas to everybody. Happy Hanukkah. Stay safe. Wear the damn mask. Keep the social distancing. Wash your hands. There's a light at the end of the tunnel. And I got to tell you, it's a great time to be alive, with mankind being able to produce a vaccine within 12 months of a virus. I mean, think about that. That's magnificent. Everybody's focusing on the negative of what's going on with the election and everything else that's happened. This is a great time to be around, yes, and that is a phenomenal step forward that we've all had. So stay safe.
And thank you to June Chung for our new appropriations staffer for setting this up and working with. This is your first live meeting that you set up for us?
Well, actually, I have to give credit to Dana Phillips.
Dana, you're there too, of course. Yes, of course. Dana.
So thanks, everyone.
Thank you to the staff, everybody.
She put this together. Thank you, guys. Thanks, June.
Thanks, Dana.
All right. Bye-bye.
Bye-bye.